So now it's my pleasure to welcome the first of the speakers for this evening, which is Dr. Zeeshan Ahmed. And I welcome him to take centre stage and tell us about his work. Zeeshan.
Thank you very much, David, Lorraine. Thank you very much, faculty as well as our fantastic participants. So yes, I'm Zeeshan Ahmed. I'm a consultant plastic and reconstructive surgeon. I was formerly a consultant at Cambridge University Hospitals before moving to the Middle East. I'm engaged in both reconstructive as well as aesthetic work, as well as non-surgical and surgical treatments. I have a strong interest in clinical education and have a master's in clinical education, as well as other interests, including clinical research and clinical innovation as well. I think from my masterclasses, hopefully I've tried to tailor them to the audience. So once we know the composition of the participants, I will try to make them tailored to those particular participants, bearing in mind the latest guidelines, views of key opinion leaders, as well as worldwide trends. One of the interesting things about training around the world and living in different countries is that you realize that your practice is very variable and different in whichever continent or country that you work in. I'll also be presenting discussions regarding clinical cases and open the floor to the participants if they have any queries or clinical cases they'd like to share or discuss as part of the theme of the actual topic of that session. And I'm going to try and broadly categorize them into three types of style of talk. So there's a range of topics that I'll be presenting over the next few weeks and months, which are a little bit didactic, and therefore we'll present them as an A to Z from diagnosis to management. They're more surgical technique-based or procedure-based areas, and I will share the known techniques as well as the way I do those operations or procedures from my experience and learning. And finally, the third style is hot topics or debates that are currently being discussed in the literature or being discussed around the world, and get my take on that. So hopefully, in response to your question, medical education has to be very adaptive, has to be responsive to the needs of the participants as well as the time. And I welcome this opportunity to engage in online education as well as staying up to date in the best possible way. So that's a summary, and looking forward to the future, really. Thank you.
Well, thank you very much, Zeeshan. You kept perfectly to time, and I appreciate that. I hope everybody follows suit. So I'm asking each of the presenters, when they've finished talking, to switch their camera off so that I can bring in the next person. If you have any questions throughout this these presentations, please type them into the Q&A rather than the text chat. So now it's my pleasure to welcome on stage Mary Accumby, who is the president and founder of Zenith Global. Mary, your 3 minutes starts now.
Good evening. Thanks, David. Thank you, Lorraine, for putting this together. It's great to be here with you all. And yes, I'm the president founder of Zenith Global Health, and I'm a minimally invasive practitioner. My background is nursing. I've been involved in teaching, training, and also capacity building, both in this country, Europe, and in low, medium income countries. So I've been part of the pioneer faculty at the University College Hospital Minimally Access Center. So involved in skills and simulation, which is one of my areas. So we've been doing that for quite a while now. And not long ago, just before COVID actually, I've been working with King's College Hospital Partnership, King's and GUICE, on a virtual reality clinical simulation project, which I believe will be useful on this platform as well. Also, I've been part of teaching and training within the multidisciplinary team. So part of the things I'll be doing will be impact of working in advanced roles within the multidisciplinary team and supporting each other. So every now and then it may so happen that I'll be working with some of the other presenters depending on what is being done at the time. Now, nursing management process and implementation will be part of what I'll be teaching and training as well on this, as well as with the medical education. So on your question, I believe that the way forward is blended learning actually. So well, pandemic has patterned this for us already anyway, I mark this, but we'll be seeing increasingly that some of the training will be online and some will be in the lecture room. And of course, some will move to virtual reality as we've seen, and I'm quite keen on that. And also when it comes to adaptability, you realize that it's important for us to be able to work with what's going on or what's available to be able to deliver the best practices. For instance, when I went to a new medical university that just been established and had to help them to set up their skills and simulation center for the whole country actually. So it was like 10 provinces and I did 7 before I came back. So we realized that some of the things that we take for granted are actually viable and can be incorporated, and we can benchmark and work together, like simulation videos and uploading that to become a resource for teaching and training, both, for doctors and nurses, scientists, everyone actually in medical education. So I'll say my role will be integrated within the team, but mainly in skills and simulation, nursing management, multidisciplinary working, and some aspects, of healthcare, like infection prevention, control, and design and management. Thank you.
Okay, thank you very much for that. We don't know due to have Giuseppe speak to us, Giuseppe Rezu. He's got his camera switched off at the moment. Giuseppe, if you can hear us, can you switch your camera on? Giuseppe, okay. Now I'm going to make you center screen, Giuseppe, and ask you to deliver your 3 minutes presentation.
Yes, hello everybody. Thank you, David and Lorraine, for organizing this and for giving us the opportunity. I'm Giuseppe Rezu. I'm a consultant thoracic surgeon. I work in Cambridge at the Royal Papworth Hospital, and my main interest is on general thoracic surgery, and in particular on minimally invasive thoracic surgery. And I'm also very interested in training. In fact, I'm a tutor of the Royal College of Surgeons. And I think this is going to be a great opportunity to share my experience. And what I will try to do during our webinars is to share my trip and my pathway from maximally invasive to minimally invasive and micro-invasive thoracic surgery. At Papworth, we develop that pathway in a multidisciplinary way. So from the surgical point of view, try to decrease the invasiveness of our procedure, and actually we pass from multi-port approach to uniportal approach and to subxiphoid approach. And on top of that, we collaborate in a very, very close way with the anesthetist, and in fact, we are developing a non-opioid anesthesia for thoracic surgery and non-intubated anesthesia for thoracic patients. And doing that, the aim is actually to reduce the impact on our patient, to improve the outcome on our patients, and to generally improve the quality of our service. That is what I want to share to the audience, and that is going to be the content of my webinars. Regarding the future of the medical education, I think is a very exciting period because we have really the opportunity to use the new technology and the new tools that the technology is giving us in order to bring everywhere in the world the best teaching and the best teachers. So I think this platform is a great opportunity to actually bring everywhere and to everyone the best ever teaching and the best way to teach. So I think it's really important to be up to date.
Okay, thank you very much for that, Giuseppe. We appear to have lost you for the moment. So I'm now going to ask Indipal Buddy to join us at Spotlight and talk about his work.
Good evening, everybody. David, Lorraine, thank you for inviting me. I'm a cardiac surgeon, and I've developed an interest in minimally invasive cardiac surgery, and I've been performing this procedure for 17 years now. I trained at Papworth Hospital and also at the Royal Brompton, so I have quite a few things in common with the three previous speakers. I've noticed they've all discussed minimally invasive procedures of one type or another. One of the things about cardiac surgery is that historically, the delivery of minimally invasive procedures has been fraught with difficulty. And I'm absolutely certain that the reason for this is not because of the lack of talent in the UK, because there's a lot of talent in the UK. It's more to do with the way individuals have been introduced to what are actually quite complex techniques. We're in the process of putting together surgery in the box and various steps that allow individuals to learn those complex maneuvers that, when added together, create a safe delivery, both for minimally invasive coronary bypass grafting as well as valve repair and replacement. Now, that's really a very highly specialized area. There are some other areas I think that it's really important in terms of ongoing education. We have a unique opportunity to deliver this now online, and COVID, for all of its downsides, has delivered the opportunity for us to communicate with our patients and with each other, both in developed and third world countries, in a way that we've never seen before. And one of the things that we've also learned a huge amount about is how to communicate with patients online. We've used short videos to consent patients prior to valve surgery. We found those very useful. And we've also learned how to digitally express the procedures and the diseases that we treat in a way that patients are able to understand. One last area where clinicians may be interested is in developing their own practices. And if they're interested in developing their practice online, I think we've also got a huge amount to offer in terms of digital marketing. So that's really all I wanted to say at this stage. There's lots more individuals who want to say something. Thank you for inviting me.
Thank you very much for keeping it short and succinct. I do appreciate that. If you switch your video off now, we'll invite our next presenter, Aman. Would you like to talk about your work? And I believe you want to share your screen. You have 3 minutes. Thank you.
Good evening. Thank you very much for inviting me, and thank you to all the other participants. I also work at Royal Papworth Hospital, and I train mostly in London and also in North America. So I work very closely with my colleague Giuseppe Rezu, who spoke a few minutes ago. Giuseppe spoke about the move from macroscopic to minimally invasive, and of course we are all involved in minimally invasive surgery, so I'd be keen to share my experience in that. But I'll also be talking about unusual major operations, and I'll be talking about the pathways that we have collectively as a team been involved with and have led to us having consistently outstanding outcomes within the UK, both on the cardiac surgery front, and also on the thoracic surgery front. With regard to medical education, I'm very excited about the immersive opportunities available. I'm just going to share one of my screens. So we, at the start of this session, we said that we would perhaps just do a bit of screen sharing. And I hadn't prepared a presentation, but really the technology is so immersive and so available. I can share this interesting case of a patient who was stabbed in the chest. It's not very common. How we started off minimally invasively and how we were repairing it until we reached the point where we started to face quite a lot of blood coming out, and it needed direct cardiac suturing through a larger incision to make the whole thing much safer. And then we all tied it up very nicely at the end. So with techniques that are at our disposal instantly, we can change the format. And what I want to do is I want to be able to really engage with the people who have come for that education. I want to share my experiences and make it as two-way as possible. So I think this is an absolutely fantastic way of immersive learning. In respect of how that's going to advance, I think we'll be using advanced technologies, for example, the Microsoft HoloLens. So myself or other surgical colleagues will be wearing those in the clinic or in the operating theatre, and in a real-time sense, we'll be sharing what we're doing. So that's what I'd like to say, in addition to the excellent comments already made. Thank you.
Okay, thank you very much, Aman. If you'd stop your screen sharing now, I'm now going to invite Dr. Yong Joo to talk us about his work. Please go ahead, you have 3 minutes. You need to unmute yourself.
Oh, thank you, David. Thank you, David, for inviting me. It's a pleasure to join the panel. And it's very inspiring to listen to all the surgical colleagues. It's really, really exciting technology, etc. So I'm a consultant in nuclear medicine. I work predominantly at the Royal Marsden Hospital. So looking back, I have had the opportunity to work with lots of good colleagues. I learned lots of things from my mentors, my supervisors and colleagues. So now I think it's a really, really good, exciting and opportunity to contribute and to pay that back and to teach the younger generation of doctors and healthcare providers. So nuclear medicine is very different from surgery. So we use lots of new technologies like PET-CT. Probably most of people heard about that. In addition to that, we also have other technologies like radionuclide targeted therapy. So those technologies are very innovative. So more recently, over the past several years, I have introduced a number of new technologies, both diagnostic and therapeutic, to the UK. So it would be really, really good to share that with other colleagues and also to teach the younger generation of doctors and to inspire them to get into innovative areas of medicine. Thank you very much.
Thank you very much for your time. I'm now going to ask Vishal to talk about his work. You have 3 minutes, Vishal.
Yes, so it's my time to rise and shine, the spotlight and the chandelier being on me. And I do apologize for the rather garish background with a little bit of Shard in London Eye sticking out like two horns of my head. I just couldn't get to change the background. It wasn't me being cocky. But thank you for inviting me to this eclectic webinar. So in short, I am a clinical hemato-oncologist. I work at Kingston and King's Hospital, and I am a hardcore clinician, dare I say astute, or at least I would like to believe so, for 4 days a week. And for the remaining 3 days, I am a teacher or an educator. And yes, you heard me right, 3 days, because I do work and teach over weekends. And to be precise, 21 weekends out of the 52 that we have got goes to teaching. You can tell that my wife is very unhappy. But what I've done over the last 8 or 9 years, apart from being the lead for education and training for hematology at King's College London, is we have started courses for hematology registrars for their wretched exit exams, FRC PAT 1 and 2, which have got a pass rate which can be woefully low, anywhere between 30 to 40%. And these are exam-oriented courses for UK-wide trainees and Ireland trainees. The course now has traveled to Kuwait, it has traveled to Oman, it has traveled to Switzerland, and it has traveled to Sri Lanka. So we do have a few smatterings of international representation. I also run the morphology courses with Professor Barbara Bain at Imperial College, and that's me being geeky and talking about morphology. Somebody said there is nothing more glamorous than taking a stitch on a beating heart. And just 3 minutes ago, you almost saw that in a video. But I get quite enthused by little microscopic echinocytes and acanthocytes under the microscope and like to spread the poetry of morphology around. So what I was hoping to bring to the table in the form of webinars, perhaps is eclectic hematology teaching, because I kind of do pan-hematology teaching. I would quite like to believe that I could do all 4 domains like oncology, transplantation, transfusion, hemostasis, red cell diagnostic with a certain amount of ease. But if there has to be a speaker who's an international expert from my towering institution, i.e. KCL, quote unquote, 20th best medical school in the world, you can tell my daughter's applying for med school entrance. So I could actually couple up with an international expert from King's, and we could play Oprah Winfrey and Graham Norton minus the theater and the trivia and do a 1:1 interactive banter, because that kind of stays with you, you know, when the jury's out and 2 speakers on the screen debate and cross-pollinate ideas. I think that's very effective. So that's me. I think my 3 minutes are up. Thank you for having me.
Okay, thank you very much for that. We are now scheduled to see Penny Kachahoju. Penny's not switched. There you are, Penny. So I'll put the spotlight on you and ask you to deliver your 3 minutes. Thank you, Penny.
David, thank you, and thank you, Lorraine, for organising this this webinar. Hi, everyone, and I'm so pleased to be here with you tonight. I think it's a fantastic opportunity to develop the medical education of the future. I'm very, very passionate about education. I think clinicians of the future will need to be educated about the clinical aspect of their work, but also they more increasingly need to manage their own clinical practice and also develop their leadership skills to be able to support their teams and run their practice well. So my role is I'm a clinical oncologist, and I work in the National Health Service in Coventry University Hospital, and I'm specializing in breast cancer. So I treat patients with chemotherapy, radiotherapy, targeted agents, immunotherapy, and I can teach you all about the newest agents, advances in radiotherapy practices, and also how COVID-19 has challenged all those practices and all the protocols changes that we have adopted for diagnosis and treatment. I do more than that. I teach in the University of Warwick, and my research interest is in clinical innovation and leadership, and how leadership can actually potentiate from getting an idea, an innovation idea, to implementation, and what's the right process and how you can do that in your own practice. I also work as a CMO in a private oncology group called Genesis Care, where I look after the clinical governance aspect of the organization. And I have supported the development of a quality improvement program, as well as a human factor training program. So I can offer a lot of teaching about how you can do similar in your own healthcare practice. We all know as clinicians that patient safety is paramount to run a safe practice. So quality improvement is a requirement from the clinician of the future to be able to deliver, as well as know their subject matter experts and staff as well. So let's join together in those talks and have a multiple ways of interacting, like case studies or just PowerPoint and questions and answers. I'm happy to deliver any course, any source of teaching. So I'm very excited to be part of this program. And I think with a whole group of clinicians we have joined together, we can also do joint talks. And as we know, oncology, hematology, as the last colleague talked about, all those specialties work in multidisciplinary teams. So it's important to recognize the role of the surgeons in the group, the oncologists working together. Thank you very much. And I'm looking forward to seeing more of you soon.
Thank you very much for Penny. Everybody's been very disciplined in keeping to their time. I'm sure Dr. Emilio Mono is going to be the same. So Emilio, please tell us about your work and the future of clinical education.
Thank you, everybody. I'm very happy to be part of this webinar with this colleague. I introduce myself. I'm Emilio Manno. I'm working the hospital Cardarelli. Is one of the large hospital in the south of Italy. I start with bariatric surgery in around 2002. And I start my practice with few cases, but I soon realized that bariatric surgery must be a separate type of surgery, independent from the general surgery. The best thing that the best result you have, it's related to a dedicated surgery. So I spend most of my time in the multidisciplinary team. It's quite like a transplantation, a transplant surgery. To become a good bariatric surgery, it's important to build a multidisciplinary team. I believe that this is the key, and I believe that one of the great weapons we have is the webinars. So I'm very excited to start with this platform, because I think that this is the best way to share my experience and to talk directly with the young surgeon who want to start. The most important thing is my specialty is that the surgical aspect is important, but the pre-op workup and the follow-up of the patients, it's important as the same. So the most important things that I could share when we start with our webinar is that it's important to build a multidisciplinary team. It's important to realize that we don't have one procedure in bariatric surgery, but we have a lot of procedure. We have so in these years disaster because there's many general surgeons who believe that a split stomach off means to do bariatric surgery. It's quite assessed that the best result it's you can have the best result if you dedicate most of the time to this specialty. Not only because we are living the COVID-19, but also because the platform, the new platform that are growing up on the web, it's are very, very, very important to reach young surgeons all over the world and share my experience and build the very, very, very important thing that it's the core of the bariatric or a bariatric set. Thank you.
Thank you very much for that. It's now Yazan's turn to share his experiences with us, and I believe he's going to show us through a few slides. Remember, you've only got 3 minutes, Yazan.
Only 3 minutes. Many thanks for the introduction, David. Many thanks for making this possible, Lorraine. My name is Yazan Masanat. I'm one of the surgeons in Aberdeen. I'll share the slides now. This is mainly to show you who I am and what my plans are for those oncoplastic breast surgery masterclasses. So I'm one of the surgeons in Aberdeen. I'm a fellow of the Chief Scientist Office in Scotland. I teach in a couple of universities, including the University of Aberdeen and the University of East Anglia, and I sit on some committees for the Association of Breast Surgery and the ESSO, and I examine the European Board of Breast Surgery and Surgical Oncology. And online teaching is nothing new to me. I run the website iBreast Book, which is mainly an online resource on breast surgery that has been running for a good few years now. My idea is about oncoplastic breast surgery masterclass series. I want to try to cover as much as possible from oncoplastic breast surgery. It's a very wide, broad specialty now. Breast surgery is not only wide local excision and mastectomy like in the past. So the idea is 6 sessions. One is oncoplastic breast surgery part 1. One is oncoplastic surgery by part 2. One is volume replacement techniques. One is on implant-based breast reconstruction. One is on flap-based breast reconstruction, and one on symmetrization and revision surgery. The first session will talk about things like simple mastectomy, scar placement, gland mobilization, simpler mammoplasties like round lock resection, lateral mammoplasty, hemi-batwing, batwing, and rotational flaps. The second one will be proper mammoplasties like vertical scar and wise pattern, how to mark, what are the pedicles to use. The third one will be volume replacement. We'll talk about things like the chest wall perforated flaps like LICAP, TDAP, LTAP, mini LD, how to use them and when to use them. The fourth will be about implant-based reconstruction. There is a huge variety of techniques across the world on where to put the implant, how to do it. Then free flap-based reconstruction from LD flaps to DF flaps to tug flaps and other free flaps. And then we took a look at symmetrization and revision surgery. As you can see, this covers most of oncoplastic breast surgery. It's very broad. No, there's not one person that can cover all this. So each of my sessions, I will have at least 1 or 2 speakers joining me. For example, the first session, I'll have Mr. Ash Kotari from Guy's Hospital in London, who trained me years ago when I was in London. And I have Prof. Sharif Omar from Cairo in Egypt. I'm aiming to get one international, not a UK-based speaker, along with another UK-based speaker with me in each of the sessions. That will be their main interest and specialty is what is addressed in that session. Many thanks.
Thank you very much for that, Yazan. You were very concise. If you could stop screen sharing now. I'm now going to invite our next speaker, Dr. Varun Menon. Varun, you have the stage for 3 minutes.
Thank you, David, and thank you, Lorraine, for organizing this wonderful webinar. I was able to now share the platform with all of these experts in their own clinical specialties. For my introduction, I'm a clinical hematologist. I'm actually working as a consultant hematologist at King's College Hospital in London. My kind of interest is in stem cell transplantation and post-transplant complications, including infections, graft versus host disease, and autoimmune problems. And I hold quite a few research grants in infection portfolio, as well as national and international investigator for a variety of commercial and non-commercial studies in the UK. I've got a very keen interest in education, and I firmly believe that clinical medicine does not follow any rules. There are always exceptions to the rules, and ultimately sharing experiences, learning from each other is how we all develop and have become clinicians to what we can and help our patients. But it's continual learning process that really is the key how we can work together and make things better and innovate better. So really collaborating, innovating together is what I firmly believe in, and that has been my motto since I started working in this field, and I have made quite a few collaborations at King's College London and other universities in London, as well as some international experts to try and work together on certain aspects of stem cell transplantation and infection problems. I work closely with Dr. Vishal, who just have heard as an expert speaker here, and we both will be holding the hematology masterclasses as kind of a plan to try and bring along some difficult gray sort of cases that often spark a lot of debates. There's no firm right or wrong answer to any of these issues that we face on day-to-day basis, and trying to give a flavor of the breadth of problems that we as clinicians in cancer medicine face, not just related to the type of treatments we can offer, but also the complications related to their underlying psychological health, the communication issues that we have to try and make sure that we are able to communicate better with these patients. So that part of the skills that we can try and bring along by that conversation we will have as members of the panel, as well as talking with the expert, but taking on questions around how to really have an overall better management plan for some of these key issues that we often face. And we hope that we can bring that along the table in a very kind of interactive manner and be very useful for our listeners, who can then gain some knowledge and then able to use that for betterment of their own patient care where they work. So looking forward to work with you all, and thank you once again to David and Lorraine to invite me to this forum. Thank you.
Yeah, thank you very much for that, Varun. I'm very impressed by everybody's timekeeping, and I'm sure Amy, who is going to talk to us about her work with mental health, will be just as disciplined. Amy.
Thank you so much, David. Thanks so much for having me here. It's great, and thank you, Lorraine, too. So my background briefly is started in working with marginalised people who don't access health care equally to the rest of the population, and I'm still involved with looking at that. I sit on one of the boards for the Wessex Global Health Network, which is looking at mental health and physical health care and the accessibility of that for migrant populations. But my sort of broader experiences in specialist secondary care psychological services within the NHS, so working with people who have comorbid complex mental health needs, for example, chronic pain and acute anxiety disorders or personality disorders and complex trauma, those sorts of conditions, or complex OCD. So I've been involved with training for a long time. I'm the mental health lead for the Cambridge Medical Academy, and so I'm responsible for writing and delivering training programs to an international reach of doctors and nursing staff, and again covering a lot of those subjects, but as well as mental health related problems for clinical practitioners, so work-related stress. I'm also a visiting lecturer at Southampton University, where I teach the PhD and MSc psychology students there. I've been involved with the design as well of health services and mental health services, so advising a number of NHS trusts and private health organisations. One of the areas of great interest to me is the integration of mental and physical health services, and so it's very exciting to be here with a number of experts from different clinical fields. So the way that I see things moving now is, very much around that integration and using online technology in order to do cross-learning and discussion. There are a range of areas that are in sort of that have been identified with real need for the integration of mental and physical health services. So to create better patient outcomes, perinatal services, public health programs, improving the mental health response for people with those who have medically unexplained symptoms. So with the masterclasses, I think it's about looking into some of these specialist subjects, increasing the level of confidence for healthcare professionals to identify and deal with mental health problems and work collaboratively to address them. I'm interested in the idea of non-specialists sort of dealing with mental health and providing mental health support. So be looking at case study based stuff, hopefully some discussions with some of the people who are here today, so discussion-based learning and collaborative conversation as part of the training. I've also started to undertake a series of interviews with other healthcare professionals, so I'm planning on incorporating some of that video content into the learning. I think sort of global lenses on mental health as well, so the global mental health field and what that can bring to the subject, and obviously sort of current research and practice will be incorporated into the training.
Thank you very much for that, Amy. We now just have two presenters left, and I'm now going to invite Professor Paul Lee to share his experiences. Paul?
Hi there. Yeah, thank you for inviting me. I'm an orthopedic surgeon, and I mainly involved in knee and hip surgery, and my work is basically based around regenerative medicine, cell works, and also computer-based algorithms. I have main research looking into gait analysis, AI programming, and computer-guided surgery, as well as robotics. One of the things that really passion to my heart is surgical education and about thinking about how to look at regenerative medicine. Within orthopedics, regenerative medicine is a very big field. We're talking about different things that we can use, such as stem cells, such as claim to be stem cell or different type of regeneration procedure. There is a big crossover between sport medicine in the UK and orthopedics. And at the same time, there is a lot of different opinions and different thinking about how we can regenerate and use biology to treat the body. So my education-based lectures will basically based around those fundamental principles, and we can talk about different surgical technique from time to time. And in terms of routine orthopedic work and trauma work, we can also do lectures on those. However, I think our main focus will be on the regenerative medicine and the injection therapy, and I believe this is the plan for the future. And well, thank you very much for inviting me to talk in here, and I'll pass it on to the next speaker. Thank you.
Yeah, thank you very much, Paul. Now we have Nina Tururio. Nina, would you like to share your experiences with us?
Yes, good evening, everyone, and thank you, David, and thank you to all organizers for inviting me in this exciting educational project. I am a consultant radiologist at Royal Marsden, and I've been lucky enough to work with amazing radiologists and physicists, and also for the last 11 years, I've been a dedicated radiologist to a large multidisciplinary group led by one of the most influential academic oncologists in prostate cancer, Professor De Bono. And he allowed me to see radiology in a different way, to try to refine the role of imaging in advanced prostate cancer, from how the best to use what we have, how can we integrate the modern imaging in offering the oncologists the support they need, such as identifying a representative biopsy site. And also I'm very passionate in introducing the whole body MRI in oncological patients, as I strongly believe that it will improve their care. It is true that imaging has always been crucial for oncological management, and we generate a lot of data, which hopefully will teach us much more in the world of AI. In addition, I think we as radiologists, we need to learn more from our non-imaging colleagues, from oncologists, histopathologists, genomic sequencing, and so on. And I think this is not necessarily covered in our normal curriculum. Therefore, I think it's important to dynamically integrate radiology in a way in which all the other members of the team can use the data we want to offer. And to me, this is crucial because I am passionate to offer to our patients the best imaging we can, to help them to understand what is their disease, not only the diagnosis where we are relatively good, but throughout their oncological journey. And I think the only way to deliver this is for all of us to speak the same language and every single member of a medical team to understand how to best use the imaging. Thank you for listening, and I hope to see you all soon.
Thank you very much for that, Nina. Now, I'm going to hand over to Amin Haji, who's recently joined us. Amin, you have 3 minutes.
Thanks very much, David, and thanks for inviting me. I'm Amin Haji. I'm a consultant colorectal surgeon at King's College Hospital. I'm also an interventional endoscopist, and I've been director of endoscopy and surgery there at King's for some time. My interest in education has been, since I was a registrar in training and also as a consultant over the last 10 years. I've been involved passionately with undergraduate and postgraduate education as a lecturer at King's College London. I also have developed a series of programs over the years in a particular program which is based on interventional endoscopy called King's Live, and we're hosting our 10th annual meeting, which is all sort of digital and virtual now in a couple of weeks' time. The education aspect has really fascinated me. So I set up a charity based to support education for training doctors and nurses called KL Foundation Trust. And this is now in our second year, where we support allied health professionals, nurses and doctors to further their education. But actually the basis of the masterclass is really to take you on a journey around colorectal disease, and particularly for my research interests on colorectal cancer. So I have a particular interest since my fellowship in Japan on early colorectal cancer. So the masterclass will focus on the initial diagnosis using latest technology of diagnosis of colorectal polyps, how to distinguish between benign and cancerous polyps, and also focus on treatments based on natural orifice surgery to deal with early colorectal cancer and complex benign polyps, and then go on to talk about advanced colorectal cancer surgery in terms of laparoscopic and open and robotic surgery. So very much look forward to joining and delivering this masterclass, and thank you for your time this evening.
Thank you very much for that, Amin. I've invited Lorraine Davison, who is a lady who's responsible for organising all of this. I think she's put a wonderful team of experts from many different disciplines together. I've been very impressed by the quality of their presentations and their expertise and their willingness to share that expertise, not only with each other, but with everyone around the world. So now I'm going to ask Lorraine just to say a few words about the TalkSurgery Masterclass, what her aspirations for this program are. Lorraine, you're muted. You're muted, Lorraine.
Thank you. Sorry about that, David. I would just like to say thank you to everybody that has joined Cambridge Healthcare Training, and I'm really looking forward to putting together some educational content to suit your needs. I think the biggest mission for Cambridge Healthcare Training is to basically be able to deliver healthcare training to every single level of healthcare professionals around the world. So today is really an opportunity to show you and showcase our experts, and to look forward to your completed surveys, and then we can really get down to the nitty gritty and then deliver that content to you.
Okay, thank you for that, Lorraine. Could I ask now all of our panelists to switch their videos on, because we're coming to the close of this, so I'd like to see everybody on screen so that we can thank everybody for their contributions. We have had a very disciplined and a very expert presentation of a wide range of skills, and I'm very grateful to you all for taking the time to talk to us today, and also for your discipline in keeping your time down to 3 minutes. I know it's not easy, because I have this same issue myself when I'm running webinars, so I'm very grateful for what you've done. I think you are a wonderful collection of people. I salute you for your expertise, and I salute you for your willingness to share that with this program. And I also, again, thank Lorraine for putting this program together. She's got some fantastic people together. So let's work together and make it a success. And it will be a success if more people know about your expertise and your willingness to share it with everyone else. So if there's any of you who would like to make any final comments or add anything, we still have a couple of minutes left. In fact, we have 8 minutes left before the hour is up. I never expected to be saying that tonight, I must tell you that. If you'd like to raise your hand, I will spotlight you so that you can say a few words before we close. Anyone would like to volunteer themselves to say something? I think you're all far too modest. Ah, there we are, Amy. Okay, Amy, I'm going to spotlight you for a second. You'll need to unmute yourself.
Yeah, I've just done that. Just to say that I would be very interested in creating something together with some of you guys, where we presented some training that looked at that collaborative approach between mental and physical health care, and how we can start to bridge that gap better. So if anybody is interested in talking about that with me, then I'd be up for it.
Thank you, Amy.
Okay. Yeah, thank you very much for that, Amy. For my part also, I think I ought to mention, having heard some of your presentations and your involvement with the use of virtual reality and other augmented reality, mixed reality and immersive technologies, both in education but other areas, to tell you about the Giant Health 2020 conference on December the 1st and 2nd, where I will be running a track on virtual reality and immersive technologies. And I would very much welcome those of you who have experience of these technologies to put yourselves forward to volunteer to be a speaker at one of my track sessions. So I have quite a lot of different sessions covering everything from preventative healthcare through medical education and training, through clinical diagnosis and assessment, to digital therapeutics and rehabilitation. So please get in touch with me. I know you mentioned it, Mary, so I would definitely welcome your contribution. And there's been so many of you, I can't remember exactly who mentioned virtual reality during their presentations, but please get in touch with me. We haven't had any questions during this session, but we did have a comment from Afsana Daliyatsky, and it says, hello all, I'd like to thank Cambridge International Training for organising this webinar, inviting one of the most expert group of surgeons to discuss the future of surgery. So I'm very pleased to have some recognition for all of your contributions. So unless there's someone else who's desperate to say something, I'd just like to close by thanking you all for joining the session today. Just one final point, Lorraine did mention that there is a survey which she's put together. This should come up at the end of the webinar when you've logged off, but if not, it will also be sent to you in the email thanking you for your participation. So please take time to complete that survey so that we know what your interests are and where to focus our future program.